So we're going to look at the different phases here as far as the healing process is concerned. And we'll talk about what goes on during the individual phases, and also as far as what's the goal, the overall goal of the phase. So if we're looking at inflammation, you have your cardinal signs. So this is kind of one of the big things always talked about with inflammation: pain, redness, swelling, heat, loss of function are the cardinal signs of inflammation. Now, as I said, one of the things that I want you to do as I'm kind of talking about this is try to think about, of all the different events of inflammation that we talk about, try and look at what causes each one of those individual signs and symptoms. And some things may cause, more than one of the signs to occur. So in other words, like what causes pain? What causes redness? Why does swelling occur? So be thinking about that as we kind of go through these individual phases. And essentially the goals of inflammation are to remove the dead, damaged tissue and get rid of any foreign debris, foreign substances in the area. That's essentially what the end goal of inflammation is. And the reason why you want to do that is you're essentially clearing out the area and preparing it for essentially the next phase, which would be the repair phase, and for that scar tissue to be able to be laid down. All right, so we're going to look at the events now. So we're getting into all of the events involved in inflammation. Again, I think as you'll see, the inflammatory phase does have a lot of things going on with it, different chemical events and things like that. So pay close attention to this, and again, try to make your connections as you kind of go through in conjunction with what we're going to be discussing with the process of inflammation. So we're going to talk about cytokines in a second. They're signaling proteins that produce some different effects. But first, we're going to look at the concept of what's called chemotaxis. So all chemotaxis is when cells kind of direct their movement in response to chemicals. So one of the things that's going to happen as a part of the inflammatory phase is that chemicals are going to be released. And what some of those chemicals are essentially going to do is create movements with cells. Okay, so we know that tissue is comprised of cells. Tissue gets damaged, cells are damaged. In order for the tissue to kind of regenerate itself, you need to have cellular actions taking place. So cytokines are a group of signaling proteins that basically produce two different types of effects. You have what are called autocrine and paracrine effects. So basically the difference between those two, so in autocrine effects, a hormone affects a cell after binding. So basically the cell releases a hormone, and then basically the hormone affects that same cell. A paracrine effect is when the hormone gets released from a cell and goes to a receptor on another cell. Okay, so the autocrine, the cell basically releases a chemical and it affects itself. It binds on the same cell. Paracrine means it's released and it goes and affects another cell. So your cytokines come in different classifications. They could be classified as chemokines, growth factors, and morphogens. Okay, so chemokines are different types. There's chemotactic growth factors and different differentiation factors. So pro-inflammatory cytokines basically can have functions related to various events that happen during the inflammatory process. Okay, so they could increase vascular permeability, so they can make your blood vessels more permeable, and we'll talk about what that does later on here. They will attract cells from the circulation to the site of injury and just promote overall cellular activities. So that's what the cytokines in general, if we were to look at all of this, what they essentially look to do. They look to produce some of these other events that we'll be talking about as far as the inflammatory process is concerned. Okay, so as I said, one of the things that some of the pro-inflammatory cytokines will do is they'll increase vascular permeability. So they'll make your blood vessels more permeable. So what we're talking about here is basically, and I'll describe what's going on in these pictures, is basically causing that blood vessel dilation to allow more cells, particularly your white blood cells, to be able to come out of the circulation and be able to do their work. So the main chemicals responsible for this are histamine and bradykinin. And what those chemicals do is they produce a change in the endothelial lining of the blood cells. So if you look here, okay, so here's your endothelial lining of your blood cells. You can see it, or your blood vessels, pardon me, your blood vessels. So if you look here, here's your blood vessel, okay? Here's your endothelium, okay? So here's the blood vessel, here's your endothelium. So what these chemicals will do is allow the gaps to kind of open up and become more permeable. And if you notice what's going on in this picture, this is a leukocyte, or a white blood cell. Okay, so what that allows to happen, and we'll talk about why this is important, is for the white blood cells to kind of get out through this gap. Okay, so you'll see as it moves along here, the blood vessels will kind of, first they'll stick to the endothelial lining, and they'll sneak out through these gaps as the blood vessels become more permeable. Now, that's both a good and bad thing. Again, this is why some of the things that, while we need it to happen, it creates a lot of, I guess, side effects, for lack of a better way of doing it. So what that does is allows the white blood cells to get out and perform their actions, which we'll see later on. The white blood cells have specific actions in the inflammatory process. But what it also does is it lets other things kind of leak out of the circulation that promotes a lot of the swelling that you'll get from this. And what eventually happens, and it happens relatively quick, is circulation eventually gets affected. So from the blood vessels dilating and becoming more permeable, it also kind of slows down the local circulation to the region, which could potentially then, slow down the healing process, if you will. So what we want to make sure is that we're doing things with our modalities to, we obviously still want to get these effects of the white blood cells coming out, but we want to limit the negative effects of the permeability changes. So again, what needs to get out? So what needs to get out are the white blood cells, okay? The issue is you'll get some other things, particularly like plasma proteins and things like that, that will also escape. What's going to happen is those plasma proteins, they're going to draw fluid with them, and then that's where the swelling will eventually form. So here's just kind of another representation of that, okay? So here's kind of how circulation will work under normal circumstances, okay? So obviously, basic circulation, you have an artery that comes in, an artery goes down into an arteriole. You have a capillary, and that's where your nutrient exchange and everything takes place under normal circumstances. And then you have a venule, which then goes into a vein. So, typically, again, oxygen will diffuse across here. You'll get your deoxygenated blood that will eventually go back to the heart. Now, under normal circumstances, some free proteins actually do escape, but what prevents, so you say, well, free proteins escape, why wouldn't that cause swelling? Well, again, if there's no obstructions and circulation is normal, the lymphatic system will kind of pick all that up and then be able to get rid of it. Okay, so again, this is a normal, healthy person right here. Okay, this isn't describing what happens with injury. Okay, so this is kind of the normal state of circulation, the process of oxygen and nutrients diffusing through the capillaries. Again, some free proteins and other things might kind of sneak out, but the lymphatic system, again, under normal circumstances, will pick that up and remove it. That's why, we don't have, why our bodies, if our circulation and everything is normal, we don't swell in our extremities. Now, here's what happens with injury. Okay, so what happens when someone is injured, okay, in an area? Now what happens is, if you notice what's happening here, so the blood vessel is going to become more permeable. It's going to dilate. It's going to become more permeable. Those gap junctions will promote. Again, we need that for white blood cells to come through. But what's also going to happen is you're going to get all these free proteins that sneak out. Now you're almost kind of overwhelming the area. Those free proteins. Plus, there's also going to be, don't forget, there's also going to be cellular debris and everything, and that will also draw fluid out as well. And what basically happens is the lymphatic system can't keep up with it. You start to get swelling. Again, the circulation from the blood vessels dilating will start to slow down. You'll start to get pressure from the swelling that forms. That will also kind of limit a lot of the capillary diffusion. So that's the important reason why we want to, one of our early goals is to try to use whatever modalities and whatever means we can to limit the amount of swelling that occurs, because that's going to slow down the healing process. So it's kind of important to do that. This process, and we're going to talk about this in a little bit, the process by which fluid comes out of these, kind of follows these free proteins and the other waste products within the interstitial space, is what's called osmotic pressure. So osmotic pressure is going to be what causes that swelling to primarily occur, because of that pull from those free proteins, the dead tissue debris, the dead cellular debris, what have you. Okay, so as we said, a lot of these events are closely related to some of the cardinal signs of inflammation. So we have swelling here. So just as we talked about, and this kind of leads off of what we were discussing, so as vascular permeability increases, you're also going to get increased swelling. It's just kind of a side effect. You can't make the blood vessels more permeable. The gap junctions aren't specific. They don't say, okay, white blood cells you can go through, but nothing else can. Okay, it doesn't work that way. As the gap junctions increase, the dilation increases, you're going to get other things that go through, which is if they're becoming more permeable, they're going to become more permeable to everything. Okay, so leukocytes and plasma proteins move out. That's going to alter your osmotic pressure. That's what we just talked about. So the pressure primarily responsible for swelling is osmotic pressure. The reason why I bring that up is there's kind of two types of pressure that regulates the fluid in our bodies. You have osmotic pressure and hydrostatic pressure. So the thing I always tell students to remember when you're trying to differentiate between osmotic pressure and hydrostatic pressure, osmotic pressure pulls, hydrostatic pressure pushes. Okay, so the difference between those two. So the difference here, okay, so we're going to get into some, physics and science here as it revolves to fluids. So again, under normal circumstances in the body, you do have a play between osmotic and hydrostatic pressure. The difference is under normal circumstances, the interplay between these two things doesn't allow for fluid to build up in our tissues. Okay, so again, under normal healthy circumstances, we don't have fluid buildup in our tissues because the interplay between these two doesn't cause that to happen. So we already know what osmotic pressure is, and I said osmotic osmotic pressure pulls fluid, and I said hydrostatic pressure pushes. So basically what hydrostatic pressure is, if we're just defining it, is basically pressure exerted by a column of water. Okay, so if you think about this outside the example of injury, the deeper you go, so if you go in a swimming pool, the deeper you go, there's greater hydrostatic pressure. The water pressure becomes greater. Okay, and it's really the depth that's important. So hydrostatic pressure will push water. Okay, therefore, what we actually will look to do, we'll actually try to use hydrostatic pressure. So a good example as to how we use hydrostatic pressure to our advantage in rehabilitation is when we elevate a limb. So say someone sprains their ankle and they have swelling in and around the ankle, we elevate the limb. What that does is it allows hydrostatic pressure to try to remove swelling when we're doing that, okay? So that's kind of the interplay there. And again, you know, when we're thinking about our bodies, gravity is really what's creating hydrostatic pressure in our bodies. So when we're walking around and everything, you know, if we didn't have our circulation working the way it would, our feet would, and our feet do actually swell slightly during the day, especially if you're on your feet a lot, even in healthy people, just not a great deal because our circulation and everything and the dynamics that occur under normal circumstances prevent that. But that's what you're looking at. So the increase in osmotic pressure is going to be what is essentially going to produce swelling in the area, okay, when we're kind of working with that dynamic. And again, this is going to be influenced by cytokines. So the chemicals in the region are going to promote the swelling as well. And again, the resolution of swelling involves the lymphatic system. So essentially what we're looking to try to do in rehabilitation and using some of our modalities and treatment techniques is to try to leverage the lymphatic system to help remove this. And by removing the swelling, you're going to do a couple different things. You're going to allow for, again, circulation to be better into the region, into the local capillaries to, again, promote healing faster, promote repair faster. And you're also going to limit some of the pain because, again, swelling can cause pain. If an area swells up, that swelling is going to put pressure on free nerve endings, and that's going to produce some of the pain that we see from the acute injury. So now we have a group of events, and I'm going to kind of summarize the plasma protein cascade. So we have these plasma protein cascades that kind of all have their, individual responses and responsibilities. So the first one we have is the clotting cascade. So the clotting cascade doesn't have any direct relationship to the signs of inflammation. So the other two cascades, plasma protein cascades, will have direct connections to the signs of inflammation. The clotting cascade doesn't. Again, the purpose of the clotting cascade is simply just to, again, prevent excessive loss of red blood cells. Okay, so this is what produces a lot of that early clotting that happens. I showed you the diagram previously of kind of the cascade that occurs, particularly the fibrinogen turning into fibrin. So this does two things. It prevents a lot of the loss of red blood cells from the bleeding that would occur, and it also provides a fibrous framework for tissue repair. So wherever that, if you think of a tissue tearing, what that initial clotting is going to do is prevent or produce kind of a structural framework for the scar tissue to start to be kind of laid down and allow for that repair process to take off. The kinin cascade is primarily responsible for increasing capillary membrane permeability. So what we just talked about earlier. So a lot of the permeability changes is going to come from the kinin cascade. So what this is going to do is produce a lot of the pain and swelling that we get during the inflammatory process. So really, this cascade is going to facilitate a lot of the aspects of acute inflammation. Again, things that we need to have happen, but as a result of them are going to produce all of these other secondary events. So the kinin cascade really does increase all of the signs of inflammation based upon what it does. And then you have the complement cascade, which is responsible for a couple for particular things. One, it breaks down the dead cell membranes as a result of the injury, so it kind of breaks them down and prepares them for disposal. The complement cascade also increases the chemical attraction of your leukocytes. Okay, so your leukocytes, which are your white blood cells, they're going to come into the area, and we're going to be discussing them coming up and what their responsibilities are. But that's going to produce the process of phagocytosis. The other thing the complement cascade also does is it does further contribute to capillary membrane permeability. Okay, so here's a table that kind of summarizes some of the chemicals. So these are important to look at. So these are pro-inflammatory substances that get secreted by mast cells. So the mast cells are the cells that are going to become very active in the region once there's signaling that damage has occurred to an area. So you can see some of the important chemicals and their purpose and their relationship to the signs of inflammation. So you see histamine produces vasodilation. What's the relationship there? Heat and redness. So if you think about vasodilation, if blood vessels dilate, it's going to create a lot of increased temperature, and it's going to create some redness in the region. Okay, so you can see that for each one of these different factors. Down here at the bottom, you see prostaglandins and leukotrienes. So prostaglandins and leukotrienes are actually a part of a group called that derive from arachidonic acid. So arachidonic acid is basically something that's present on the cell membrane of most cells. These act as, major regulators of the inflammatory process, and then so once basically they get exposed to the pro-inflammatory cytokines, they get released. So again, they have specific actions that they're involved with, and we'll talk about, again, so we need these to occur. Kind of tells you here why, what their individual purpose is. But again, there's going to be kind of secondary negative effects, as we see with the relationship to the signs of inflammation, but also some other things that do occur. So, take a look at this chart. Again, I think it provides a nice little summary of some of the chemicals and how they kind of relate to some of the instances, some of the events that we had described previously. Okay, so another important event, and we saw how the earlier events produce this, is basically the increased presence of white blood cell activity in the region. So the white blood cells are going to be responsible for kind of clearing out a lot of the debris in the area. So they have what's called a phagocytic role, and we'll talk about what that basically is and what the process of phagocytosis is. Essentially, to make it sound real simple, it's basically the process of the white blood cells going out and basically attaching itself to the debris and essentially finding a way of disposing of it. So if you look over here in this picture, you see kind of an actual representation of what it looks like, and then a little graphic representation. So in this instance, it's relating it back to it being bacteria. We know white blood cells also help to remove bacteria, but think of this also as maybe like cellular debris or something like that in the area. So again, the white blood cells have to kind of get rid of that or go through the process of phagocytosis. So if you notice what's happening here, if you look at it, the white blood cell is essentially engulfing this debris, and what it does is it kind of breaks it down and digests it, and then helps to eliminate it from the area. So you see both kind of representations here. So here's your white blood cell. Here's the debris in the region. And you see what it actually does. It kind of engulfs it. And then inside the white blood cell is something called a lysosome. Okay, so a lysosome is what basically is responsible for kind of breaking down and digesting that foreign substance. And then again, it will release it into the system to where it can be more easily eliminated. So this process is influenced by cytokines. So chemicals in the area get released that are going to further help draw white blood cells in addition to the increased vascular permeability. So the vascular permeability is going to make it easier for them to come out, but there's also chemicals that will produce and cause the white blood cells to kind of move in that fashion. there's two types of white blood cells that are primarily involved here. You have your neutrophils. So the neutrophils are released early on in the process, okay? The neutrophils are released early, and they kind of do the initial kind of clearing out, I guess, if you will. Now, part of the issue with the activity from a lot of the leukocytes, particularly the early release of neutrophils, is they produce a lot of oxidative stress. So again, while they need to go out and eliminate this debris early on, the oxidative stress, because of the reactive oxygen species that gets released, that also produces, again, some bad negative effects. It could also contribute to more edema formation. So again, we want to kind of limit that edema formation early on throughout the inflammatory process. So they kind of come out earlier. So they're released within, minutes to hours. And then long term, the type of white blood cells that get released are your macrophages, okay? So about 3 to 7 days post-injury, the macrophages will get released, okay? And they will continue to go through the process of phagocytosis. But these will also help to promote some of the early phases of repair. So as I said, these phases aren't mutually exclusive. They do overlap slightly. Okay, so it's not like inflammation ends on this day and then that day repair is going to start. The repair process is going to start taking place kind of once this gets kicked off. So the macrophages are going to help promote early fibroblast activity, which will gradually take us more and more into the repair phase early on as we kind of move through. Okay, so again, process here is phagocytosis. So the movement of the white blood cells will produce phagocytosis. Neutrophils are released first. Then later on, macrophages are released, okay? And again, the whole process involves basically the white blood cell engulfing the debris. The lysosome inside the white blood cell will break down that foreign substance, and then basically that will help to eliminate a lot of the dead cellular tissue in there, okay? The other thing to note is that lysosomes also release chemicals that stimulate the complement cascade and kinin. So again, there's a lot of interaction between these events, and that's where some of this could get confusing. So understand what goes on during the event and how it ties into some of the other events that occur. So here's just a picture kind of demonstrating, and this is in your textbook, kind of talking about the leukocyte infiltration. So basically, you're looking here at a kind of representation, your time after injury. So early inflammation, you have, again, a lot of neutrophils kind of coming into the area. As time moves on, the macrophages really kind of take over, going into the repair phase and then into the resolution and remodeling phase. Okay, so that kind of takes us, so we've kind of gone through all the primary events. Now we're going to kind of look at the termination and early repair. So, as I said, these events kind of still overlap. So we get into that fibroblastic repair phase. So as I said, the macrophages begin to promote repair. So once the leukocyte activity stops, you start to get more macrophages into the area. Now you're going to start that process of kind of laying down some of that early scar tissue that's going to occur during the repair phase. So ideally during the repair phase, what we're looking to have happen is for that scar tissue to form, and that scar tissue is going to go through various forms of maturation and restructuring as we kind of move through the repair phase into the remodeling phase. Now, one of the things that we're going to want in particular, again, the modalities are nice. The physical agents that we're going to use are going to promote, exercise and movement. We need an appropriate amount of stress on the tissue. So what you don't want to have happen is kind of taking it, you obviously don't want to be too aggressive because you don't want to damage your repair. But at the same time, if you're not aggressive enough, and you keep something maybe immobile for too long, you're going to get too much scar tissue and it's not really going to be prepared to remodel the right way. Okay, so it's gonna, so really at this point, the body's trying to now kind of turn down inflammation. We don't need any prolonged inflammation. We want to promote that repair phase. So some of the modalities that we're going to use in the early inflammatory phase is basically to limit the effects. So we're not trying to eliminate inflammation. Okay, sometimes people still inappropriately say that. We're not trying to eliminate inflammation. We're trying to reduce the negative effects of inflammation, because that will get us into our repair phase earlier and allow us to do more with the patients. So the length really is going to depend on the extent of the damage. And I would also say, to a degree, also how effective, early treatments are, how compliant the patient is with some of the early things you would do with them. But again, typically the length of the inflammatory phase could be anywhere from 1 to 5 days. Okay, you'd probably see that, in most cases, you're probably looking at 2 to 3, but it can go upwards to 5 days if you really have a lot of damage, or the patient maybe isn't as compliant, with the actual treatment.